Colon cancer doesn't wait, and the warning signs? They're often ignored until it's too late. You may feel fine. You may even think you're healthy. But something dangerous could be growing inside you without a single clear sign until it becomes life-threatening. This is not just about stomach pain or blood in the stool. This is about knowing the truth before it's too late. A simple test called a colonoscopy can find it early and even save your life. But most people don't know what it really is, how it works, or why it matters so much. In this video, we'll break down everything you were never told about colonoscopy and explain the 8 most common warning signs of colon cancer you should never ignore. What is a colonoscopy? A colonoscopy is a medical test where your doctor looks inside your colon and rectum. It helps find serious problems like ulcers, swelling, bleeding, polyps, and even cancerous tumors. This test is done using a special tool called a colonoscope. It's a long, soft tube that can bend, and it has a small light and camera at the end. This camera sends live video to a screen so your doctor can clearly see every part of your colon. The colonoscope is gently inserted through the anus and slowly moved up through the rectum and into the colon. It goes all the way to a section of the small intestine called the terminal ileum. This full view allows your doctor to check for anything abnormal inside your large bowel. The camera tip also contains a light, a channel to spray water or air, and another passage to insert tiny tools. How the colonoscope works? During the procedure, water or air is pushed through the colonoscope to clean out any leftover stool or debris inside your colon. This helps your doctor get a clearer view. If your doctor sees anything unusual, like a polyp or a suspicious area, they can insert tiny forceps or wire loops through the scope to remove the tissue or take a sample. This is called a biopsy, and it's checked in a lab for signs of cancer. Your doctor may also record videos or take photos during the procedure for further review. The process is done carefully and slowly so every inch of your colon can be checked. What happens during the procedure? A colonoscopy usually takes around 30 to 60 minutes. It is performed in a hospital or clinic by a trained specialist called a gastroenterologist. Before starting, you'll be given a sedative to help you relax. You'll be asked to lie on your side while the colonoscope is inserted. Since the tube is flexible and can bend, your doctor can move it through the natural curves of your colon without causing pain. Sometimes the doctor will gently press on your abdomen or ask you to change your position to help the tube move forward smoothly. During the whole test, the live video plays on a screen in high definition, so your doctor sees everything clearly. What the doctor looks for. As the colonoscope moves through your colon, the doctor looks for signs of any problems. Air may be used to slightly inflate your colon to make the passage wider and easier to examine. This can cause pressure or mild cramping, but breathing slowly and deeply can help you stay comfortable. The colonoscope is slowly removed while the doctor checks again on the way out to make sure nothing is missed. If any polyps are found, they are removed right away. Polyps are small growths that are usually not cancer, but they can turn into cancer over time. That's why removing them early is so important. How polyps are removed. The most common way to remove a polyp is called snare polypectomy. A wire loop is passed through the scope and wrapped around the polyp. Then, a small electric current burns it off. Since polyps don't have nerves, this doesn't cause pain. The polyp is pulled out through the tube and sent to a lab for testing. Other methods are also used depending on the shape or size of the polyp. After the colonoscopy. Once the procedure is done, you'll rest in a recovery room while the sedation wears off. You might feel some gas or mild cramping, but it usually goes away quickly. Because of the sedation, you won't be allowed to drive yourself home. Make sure a family member or close friend is there to take you back. You should take it easy for the rest of the day and avoid making any big plans for at least 24 hours. Your doctor will usually explain the results before you leave or in a follow-up appointment. 8 early warning signs of colon cancer. Even though colon cancer often grows silently, there are 8 early warning signs your body may be giving you. Knowing these could save your life. Change in bowel habits. If you suddenly have diarrhea or constipation that doesn't go away, or if your stool becomes very thin or changes shape, it may be due to a tumor blocking your colon. Blood in the stool. Bright red blood or dark, tar-like stools can be signs of bleeding inside the colon. While it can be caused by other conditions like hemorrhoids, it should always be checked by a doctor. Abdominal pain or cramping. Constant pain, bloating, or a feeling of pressure could be caused by a growing tumor that's blocking stool from moving normally. Unexplained weight loss. Losing weight without trying can happen if cancer is affecting your body's ability to absorb nutrients. Extreme fatigue. If you feel tired all the time and nothing helps, it might be from internal bleeding that causes anemia, which lowers your red blood cell count. Feeling the urge to go, even when you just went. This is called tenesmus and can happen if a tumor near the rectum is tricking your body into thinking there's still stool left. Gas and bloating that don't go away. Colon cancer can cause blockages that trap gas inside, leading to swelling and discomfort. Bleeding or discharge from the rectum. If you see blood even when you're not having a bowel movement, it could be something more serious than hemorrhoids. Risk factors you should know. Some people have a higher chance of getting colon cancer. These risk factors include age. Risk increases after 50. Family history. If your parents or siblings had colon cancer or polyps, your risk is higher. Diet. Eating a lot of red or processed meats and not enough fiber can increase your risk. Lifestyle. Smoking, drinking too much alcohol, not exercising, and being overweight can all raise your chances. Health conditions. Diseases like Crohn's or ulcerative colitis make colon cancer more likely. Knowing your risks and watching your body for signs can help you take action early. Why early detection matters. Having these symptoms doesn't always mean you have cancer, but they should never be ignored. Finding colon cancer early makes it much easier to treat and increases your chances of survival. That's why regular checkups and colonoscopy screenings are so important. Most people should get a colonoscopy at age 45, but if you have a family history or other health risks, your doctor might ask you to start earlier. This test can find cancer early and even prevent it by removing polyps before they turn into cancer. Colon cancer is serious, but it can be prevented. Know the warning signs, listen to your body, and get checked if something feels wrong. A simple test could save your life. If this video helped you or someone you care about, make sure to subscribe for more easy, life-saving health tips.